Hi, my name is Morgan Stevens. I'm a PN student at Wilson State College, and today I'll be showing you how to give intradermal, intramuscular, and how to reconstitute a vial. Now, before I can begin, I'll need to look at my MAR. I'm currently in the med room. I'm looking at my MAR. So my patient is Shirley Koss. So Shirley Koss, perfect. 33-year-old female, perfect. Date of birth 4/3 of 1987. Shirley came in with pneumonia, and then it looks like the doctor ordered a PPD test on her right inner arm, okay? So tuberculin purified protein derivative diluted 0.1 ml at 10 a.m. And right now it's about 10:45, so I'm within the 30 minutes before and after the time per policy orders, and then 1 dose, perfect. And then he ordered ceftriaxone 250 milligrams IM, 1 dose, so I know for my dimensional analysis, that will be 0.5 mils. And then that is also for 10 a.m. And that is an antibiotic. And then the PPD is to test for tuberculosis. And then the third thing he ordered is Phenergan, 25 milligrams IM, twice a day, PRN. And then he said, please preferably Z-track method in administrating this medication. Okay, so it looks like this is within. Perfect. So I'm looking at this. Shirley's date of birth is correct and everything seems to be correct. And then Shirley's allergies are penicillin and furosemide. So I know that these medications orders have no contraindications or interactions with the meds. So that's good. So perfect. So I'm gonna put away the healthcare provider's orders since it matched up with my MAR, and I'm gonna perform hand hygiene. Make sure that dries. And then I'm gonna grab my gloves. And I'm still in my med room. There we go. They're nice and on. Okay, perfect. So for this, I'm gonna be checking my meds. So I'm gonna be first, my cap fell off, but that's because I had to fill my meds, so we'll just pretend that didn't happen. So first, I'll be looking at my ceftriaxone, and so that's 250 milligrams, perfect, for 10 mils of sterile water to be reconstituted, perfect. And then it will be the 0.5 milligrams, perfect. And then the date is 2023, so the expiration date is good. And there's no cracks or discoloration, so that is good. And then Shirley Koss at 10 a.m., so perfect. And then next I'll be moving on to my tuberculin. Okay, and then 0.5 mils, so perfect. Expiration date is good, 2064, so we're good. And 1 dose at 10 a.m., so perfect for Shirley Koss. And then lastly, my Phenergan, so that is 25 milligrams IM, twice a day as needed. And I previously went into the patient's room and Shirley expressed to me that she was still feeling nauseous, so I'll reassess when I get in the room, but I will prepare this for my 10 a.m. dose. So the expiration date was still good on that, no cracks or anything, so that is good. And 10 a.m. Shirley Koss. So I just got done with my first med, so I'm gonna move on to my second. So I'm gonna go and do my I'm gonna do my TB first, actually. Sorry. So I'm gonna have that package ready, and then I'm gonna uncap my lid. And then I'm gonna wipe it for 10 to 15 seconds. Perfect. And then I'm gonna let that air dry. And then I know for this, because with my dimensional analysis, that I'll be drying up 0.1 mils. So So 0.1. And then I'm gonna be injecting this in. And then making sure it's above water level, pushing it in. And I'll be turning. Now I got a little bit of air, so I pulled back more than I needed. So I'm gonna be flicking the bubbles out. And then I'm gonna be pushing back that 1 ml. So now it's at that 1 ml mark, or 0.1, sorry. And then I'm gonna be doing my one-handed scoop. So, sorry, one-handed scoop and then closing at the base, not the tip. And then I'm gonna be double checking, so this will be my second, and making sure that I have what I need. So I've got tuberculin, and then dosage 0.1 mils. Okay, and then 1 dose, and initials, and then it's currently 9:48. So perfect. So I'll put this on. Okay, so that is good, and I checked my expiration date is good, so that is good to go. And then next I will move on to my, so since I did my tuberculin, I'm just going to put a little dot there just so I remember. And then I'm going to be moving on to my Phenergan. So for this Phenergan, it's in an ampule, so I'll need to clean this. Make sure it's all good, there's no cracks in the bottle. And then I'll make sure all the water is from the top, so I get exactly 1 ml. And then I'm gonna get my needle ready. There we go. And I'm going to be looking up from the right end. Perfect. Now this filter needle is on here so that when I draw up in my ampule that there are no glass shards or anything. So I'll leave that, and then I'm gonna get my gauze ready to break my ampule. So I've let this air dry, throw this away as well. And then I'm gonna break this away from me. So 1, 2, 3, perfect. Put there, and then I'm gonna put this in my sharps container because we don't want glass in the garbage. And then for this, I don't need to draw up anything. So I'm gonna get my hand ready. Let me get it ready. Okay, and then I'm gonna make sure not to touch the middle. Okay, perfect. So I got just sucking out the rest of mine. So perfect. And then I'm gonna be putting this in my shards container. And then I'm gonna be doing, actually I'll be flicking out the water, the bubbles, and then I'll be making sure it is 1 ml. Okay, perfect. So it is right on 1 ml, so that is good. So my Phenergan is good. So I'm gonna recap this one-handed scoop, and then I'm gonna put it back on.
And then I'm gonna take it away. And then I'm gonna put the correct needle on it for when I give it. So I'm just gonna screw that on, perfect. And then I'm gonna be doing my second med check. So, Finnegan. And then, perfect. And then 1 ml. Time, 49, perfect. So I'm gonna put that on there. Okay. So let me just get rid of my garbage. And so lastly, I'm going to be doing my ceftriaxone. So I'm not actually going to be administering this just for video purposes. I'm going to be showing you how to reconstitute a medication. So this. Okay. So then I know I need 10 mils, so I'm drawing up to 10 mils. There we go. And then I'm just going to be injecting this with sterile water. And so I checked 10 mils, so that's correct. The expiration date is good. So I'm going to make sure I'm above the water line. And be slowly pushing down. And then I'm going to be slowly retrieving my 10 mils. So I didn't get my 10 mils, so here. Let me try that again. So here, let me get my 10 mils. So drawing back my 10 mils. My 10 mils, perfect. And then above the water line. There we go. This is how it's actually supposed to go the first time. So I'm just going to be drawing a little bit back farther because so let me see. Enough. So let me push up. So here I need a little bit more, so let me just push up. Perfect. So I've got my 10 mils. So once I've gotten that, sorry, it's taking me so long, I can put my sterile water aside. And I'm gonna open this up. And then I should have done this beforehand, but I'll wipe this for 10 to 15 seconds. I would have recapped my needle, but I threw the top away, so let it dry. Throw that away. And then we're going to be injecting my 10 mils. There we go. And we're going to be doing it slowly so no air bubbles happen. And then lastly, I didn't mean to do that, but normally you wouldn't do your, and so then I'm done with that. So then I can put this in the sharps, and then I'm gonna not vigorously, but just enough to mix it to make sure it's evenly distributed. I'm gonna roll this back and forth. And you usually would do this longer, but for video purposes, see, just a little bit longer, just got a couple flecks in there. Okay, so perfect. So we got my ceftriaxone. So getting this. I got that. And then I'm just gonna re-wipe my top. So then I'm gonna pull back to 1/2 ml with my dimensional analysis. And then I'm gonna poke, make sure I'm not in the liquid. And then I got a little bit more, so I pulled back. So let me just pull, there we go. And let me make sure it says 1/2 ml. So perfect, so let me just pluck out any air bubbles. So I've got my 1/2 ml. So now I will recap. And then I'll be writing my label. So I got my ceftriaxone, as we saw. It was not expired. The injection, 10 ml with sterile water, perfect. So, NS, and then the date, 10/05/20, and then I've got the mils, 0.5. Here, let me just make that a little bit clearer. There we go. So, label. So that is my third check. Okay, so perfect. And then I'll be checking this because I'm not gonna be administering this. I'll just do my third one. So we've got my ceftriaxone. We've got 250 milligrams, and then we've got 0.5 ml, correct? And then it's not expired time. Perfect, still 9:55, so we're good. Ceftriaxone, so perfect, so I can set that aside. And it's not expired, surely cost at 10 a.m. Okay, so now I'm just gonna move this over. And now I'm currently still in my bedroom. So I'm gonna deglove, and then I'm gonna do hand hygiene. Make sure I get it all dry so I have no sticky gloves. And then I'm gonna go to my patient's room. So, hi Shirley. Hi, how are you doing today? Doing okay? Good. Okay, so I'm just gonna put on some gloves. But Shirley, can you tell me your date of birth? Or here. Get a new glove. Okay, so you said 4/3 of 1987. Okay, let me just double check your wristband. Perfect. And then Shirley, do you have any allergies? Oh, you do. Okay, penicillin and furosemide. Okay, because I see your wristband and it's here on your chart. So I'm not going to be administering anything with that today. What I am going to be administering today is a TB shot. It's just going to go a little bit under your skin. And it's just a test for tuberculosis we do in the hospital a lot of the times. So we'll do that. And then I'll also be doing your Phenergan. Are you still feeling nauseous? Okay, you are. Okay, so I'll get that administered. Let me get on my glove correctly. There we go. Whew. There we go. Okay, perfect, Shirley. So Shirley, do you have any questions before I begin? Okay, no? Okay, you're still doing okay? Okay, so firstly, what I'll be doing is your Phenergan. So for nausea, that's going to be a Z-track method. So what I'm going to do is I'm just going to pull this back so I have easier access. And then, let's see, let me get my gauze ready. And then I'm just going to be wiping from inner to outer. Okay, Shirley, are you still doing okay? Okay, Shirley. So, I'm going to be checking this. So, Phenergan, 25 milligrams, IM, twice a day as needed, and you still said. So, it's currently 10 o'clock, so we're right on schedule. Shirley cost, perfect. So, we're good. So, just double checking. Yep. And so, you have that ready. Okay, Shirley. So this is just going to be an injection, and I'll count down with you, okay? So, let me, and then I'm going to pull to the side, okay, Shirley? And I'm going to go at a 90-degree angle, okay? Okay, perfect. 1, 2, here, let me, and then I'm making sure it's 3 fingers. It's kind of hard to get on your arm, but we'll have that. And then I'm going to go pull laterally, and then ready, Shirley, we're going to go 1, 2, 3. And then we're going to slowly inject. And then I'm just going to leave that there for a little bit. And then we're going to take out. And I'm going to put my safety on. And I'll throw this away. How are you doing, Shirley? You doing good? Okay, perfect. Okay. Let me make sure you're not bleeding. Okay, you are not. So, if you were, I would have helped you with put a Band-Aid on, but I'm gonna put this back up, and then Shirley, I'm just gonna be moving down to your skin, so I'm gonna be doing your TB next. So this is gonna be your forearm. Perfect. Thank you. Okay, let me make sure it's on there good. Okay, as good as it will get. So let me just clean up my materials, and then let me get a gauze ready. And then let me double check before I give this my med, and then I will clean your site. So we've got tuberculin purified protein delivered to 0.1 mil, so that's what's on here, perfect. And it's 0.1 mil, perfect. At 10 a.m., so it's currently 10:01, so we're right on track. And then Shirley costs, so we're all good, Shirley. So let me just get your alcohol prep. I'm going from inner, outer. So Shirley, this is just going to be a little one. Let me get off the label so it's easier for me. And then I'm just going to have this in my hand. And so I'm just going to be going like this, Shirley. Okay, let me pull off the top. Perfect, Shirley. How are you doing? Doing good? Let me just get this. And then I'm going to make sure my bevel is up. And I'm at a 15-degree angle. Okay, 1, 2, 3, sorry. And then I'm just going to be making a little bleb. As you can see, that's kind of hard to see, but my bleb is right there. How are you doing, Shirley? And I'm going to be putting my safety on, putting in the sharps container. And then I would hold, but I wouldn't massage because this is a Z-track, so you don't. You still doing good, Shirley? Okay, cool. And then as you can see, it's kind of faint because of the marking we make, but it's right there. So then, Shirley, what I'm going to do is I'm going to circle this, and I'm going to put my initials and date and time. Okay, perfect, Shirley. Are you still doing good? Okay. So, Shirley, I'm going to be documenting all this, so let me just document. I verified I did my all of my TB and my Phenergan. Perfect. And then I'll be documenting this. I'll be taking off my gloves for forming hand hygiene and make sure my site is cleared and then make sure her call light is within reach. Shirley, do you need anything? Okay, no? Okay. Shirley, I'll be back in a little bit. Just let me know if you need anything. And then I'd be documenting and making sure to provide privacy. Thank you.